Okay, we have here the pathology related to your malarial infections. So first one, we have here your anoxia and anemia. So anoxia and anemia characterized here by the red cell destruction. So therefore, you have been deprived here with oxygen. And the second one, we have here the splenomegaly because of the increased sequestration of your spleen by your parasitized red cells. And hepatomegaly inflammation of the liver because remember meron siyang hepatic stage or the pre-erythrocytic stage. Another one, we have the toxins produced here results to the damage in your parenchymatous organ that result here to your myocardial weakness or muscle weakness, heart weakness. Also here, liver damage. And then another one, it could also result here to damage of your kidney. In the case of your Plasmodium falciparum infection, it try to produce here a sticky red cells which try to block or clog here your blood vessels. It might result here to your hemorrhage, to your anoxia, and could also result here to the thrombus formation, or thrombosis. We also hear the black water fever related to your Plasmodium falciparum because of inadequately treated with the quinine drugs. Okay, and this is characterized nagkakaroon siya ng black water fever. It's because here of the destruction of your or rupture the red cells, and the patient would have hemoglobinuria, hemoglobinemia, where the red cells here, hemoglobin ruptures, which eventually converted to your oxyhemoglobin, and later on magiging methemoglobin, and therefore magiging black color siya, and therefore you have your black urine for the patient becoming your black water fever. Okay, we have here laboratory tests that would help us then to diagnose someone to have infection with your malaria. First one, we have here your blood smear preparation. So taken here during the febrile stage of the patient. So make sure that the patient's on the fever or feverish ang patient. If the patient's not on fever, so expect na magne-negative ang result. You're not able to recover the parasite. So there are two forms of smear prepared here. The first one, we have your thin smear. So we have the feathery edge, the short thin smear. So basically that one would allow you the species identification and also allows you then to evaluate the morphology of the RBC. Remember that in our characteristics kanina, so there are some species here which are having the normal na RBC morphology like in the case of your falciparum, in the case of your malariae. But in the case of your vivax, so meron siyang enlarged and the pale ang kanyang RBC. Then we have also enlarged and oval for the ovale. Then you could only evaluate that one if you are having the thin smear. Okay, pero pag light parasitism ang ating thin smear, hindi siya makarecover ng parasite. Okay, the thick smear on the other hand, so it allows you to recover here the parasite even if that one is in a light parasitism, or mean to say the parasitic load here on the patient is very low and they're still able to recover if you're having that thickness smear. So after that one, you try to stain, you try to fix with your methanol. Okay, and that's the best na fixative for your smear for the malaria parasite identification. And the stain here, you could have your you could have the GEMSA, but the GEMSA is the best one. Remember pala dito sa thick smear, you need to perform the hemoglobinization. So dip that one in tap water to rupture, to release hemoglobin. That would help you then to have an easy identification kasi pag hindi mo siya na-release hemoglobin, mahirap mag-identify for that. Okay, another one, we have here the serological tests for detection of your antigen-antibody reactions related to your malarial infections. You could have here the complement fixation, you could also the ELISA. So we have here another one, we have the parasite F for your Plasmodium falciparum, which make use of microtiter plate and the use also of dipstick reaction. The QBC, quantitative Buffy code here, so that would have an easy for you then to recover the parasite, the Buffy code. Just need to stain that one with your acridine orange. That would enable the parasite to take up the stain. That will easy for you then to identify the parasite. Okay, we have also here some conditions, medical conditions that would eventually provide here protection or immunity for some population. The first one, we have here your infants. For infants, approximately 3 to 4 months we are protected here from the infection because they are protected by the maternal antibody. Plus, they still have here the immature red cells, and that immature red cell could not support the life cycle of your parasite, and therefore the parasite died. Next one, we have here the glucose 6-phosphate dehydrogenase deficiency. The patient here would provide protection against your Plasmodium falciparum infection. So this defects here in your hexose monophosphate chain pathway, and the main product of that is your ribose 5-phosphate and glutathione also here. So therefore, ribose 5-phosphate is needed by the parasite for their metabolism since hindi siya makapag-produce kasi wala siyang enzyme, and therefore it will not support the life cycle of your Plasmodium falciparum, making that one as highly protected here against the infection with your Plasmodium falciparum. Another one, we have here the DAFI negative individuals, so that will provide protection here for the Plasmodium vivax. So DAFI negative are very prevalent, very common among African Black population because again, the DAFI antigen, the FYB antigen here, eventually that serve as the receptor binding site for the parasite to invade the red cells. Since the patient do not have that DAFI antigen, so wala siyang binding site and therefore could not parasitize the red cells. Sickle cell anemia, so that also provides protection here against your Plasmodium falciparum. Sickle cell anemia here would have the red cells having abnormal morphology because one would have here the C, the S shape. And remember that the red cells having abnormal morphology is most likely as the blood is being delivered to the spleen. The spleen, we're going to sequester that one, try to kill that one because they have abnormal morphology. Plus, again, ang red cell natin dito, hindi siya normal in shape. And therefore, it would just not able to support the life cycle of the parasite. The parasite, the Plasmodium falciparum here will die. Another one, we have here your thalassemia hemoglobin F provides protection also for the vivax. And patients having ATP deficiency would also provides also protection with your Plasmodium falciparum because your ATP is needed here also by the parasite. Since the patient walang ATP, it would not support the life cycle of the parasite die. Okay, now we have here for the treatment. So we classify the drugs here as either suppressive drugs. Suppressive drugs here try to prevent the appearance of the signs and symptoms. Therapeutic drugs, on the other hand, inhibit here the erythrocytic physiogeny. And we have also here the radical cure, your primakin. So try to inhibit here the late exoerythrocytic stage. Then we have also here the gametocidal, try to kill here the gametocytes. Sporozoidal, try to render your sporozoids here, which is render that one not infective to the patient or to the human. We have also here the Chinese medicinal plant Artemer. So this is also effective for the treatment. And we have your mefloquine. Okay, for those patients who are resistant against the chloroquine, so you can use this one pag resistant na sila sa chloroquine. Okay, and lastly, we have here for the prevention. So you can have your insecticide-treated nets. So parang mosquito nets lang siya. But that one is treated here with insecticide, so therefore, mamamatay ang mosquito natin. We have also we have here the indoor residual spraying, fogging, although din discourage ang fogging because it's just not able to kill the mosquito, but rather pupunta lang siya sa other places. You could also have here your larvivorous fish which try to feed on the larva of your mosquito in the water. So that's your Gambusia affinis. Okay, so thank you. That's all about your malarial infection.